Ringworm is not actually a worm, it's a contagious fungal infection that can silently spread between animals and even to humans. If you understand it properly, you can diagnose, treat, and control it effectively. Dermatophytosis, commonly known as ringworm, is a superficial fungal infection that affects the skin, hair, and sometimes the claws of cats and dogs. An important point to remember is that it is zoonotic, meaning it can be transmitted from animals to humans. Now let's discuss the causative organisms. The most common pathogen in cats and dogs is Microsporum canis, which is responsible for the majority of cases. Another important organism is Trichophyton mentagrophytes, which can affect both small and large animals. Now come to how this disease spreads and its risk factors. Dermatophytosis is mainly transmitted through direct contact with infected animals, while environmental spores can also cause infection if there is minor skin damage. Young animals, especially those that are free-roaming or kept in overcrowded and stressful conditions, are more commonly affected. For infection to occur, the presence of fungal spores, skin trauma, and moisture are important factors. It is important to understand that the severity of the disease depends more on the host's immune response rather than the virulence of the fungus itself. Now move to the clinical signs. Affected animals typically show hair loss, scaling, crusting, and redness of the skin. Itching may or may not be present. In dogs, nodular inflammatory lesions called kerions can sometimes develop. In cats, certain cases may present with more severe or atypical lesions, making diagnosis slightly more challenging. Now let's discuss diagnosis. There is no single gold standard test for dermatophytosis, so a combination of methods is usually recommended. Direct microscopic examination of plucked hairs is commonly used, where infected hairs appear abnormal and fungal elements may be visible. Wood's lamp examination can also help, as some infected hairs, especially those infected with Microsporum canis, show an apple-green fluorescence. Fungal culture is another important diagnostic tool, where samples from lesions are cultured and observed over a period of about 2 weeks to identify the organism. Now come to treatment, which is aimed at shortening the course of disease and reducing its spread. Systemic antifungal therapy is commonly used. In cats, Itraconazole is the drug of choice and is typically given in cycles, meaning 1 week on treatment followed by 1 week off. In dogs, Itraconazole, Terbinafine, or ketoconazole may be used depending on the size of the dog and clinical judgment. Now let's move to topical therapy. This plays a crucial role because it reduces fungal contamination on the hair coat and limits environmental spread. Common options include antifungal shampoos containing miconazole combined with chlorhexidine, used 2 to 3 times per week, and rinses such as lime sulfur applied regularly. In some cases, clipping long hair coats may be helpful to improve the effectiveness of topical therapy. Topical therapy should always be continued until the infection is completely resolved, even if systemic treatment has been stopped. Now finally, environmental control is essential. Fungal spores can persist in the surroundings, so regular cleaning is necessary. This includes removing hair and debris, washing bedding, and cleaning surfaces to reduce contamination. Infected animals should be isolated, but care should be taken to avoid excessive stress, especially in young animals. So overall, dermatophytosis is a contagious and zoonotic fungal disease. Understanding ringworm is not just about treating a skin disease, it's about breaking the cycle of infection and protecting both animals and humans. Thanks for watching VetCare. If you found this helpful, don't forget to like, share, and subscribe for more simple and clear veterinary lessons.